Thank you very much. I now recognize myself for 5 minutes. It's interesting listening to all of your testimony, and I'm going to deviate from my questions. I'll ask the question, one of the questions I plan to ask, but then I'm going to deviate. Mr. Butler, Mr. Retzer, can you share what you've heard from your members about their experiences with therapeutic medicinal use of cannabis or cannabis-derived products?
We haven't really received any information from our members directly about the product. We are interested in seeing the research go forward and the evidence that it provides efficacy to meet the clinical needs of veterans so that they can sustain their lives more. So we're hopeful that the evidence will prove that it has efficacy in the support of clinical needs for the veterans.
Mr. Retzer?
Thank you for that question. Our membership actually has a resolution, as a resolution-based organization, where we call for the research of medical efficacy of cannabis for service-connected disabled veterans. So it's very important to us. And we have also published multiple articles with regards to the cannabis studies and the innovations in the direction for needs for options for our veterans.
I hear similar things from the veterans in my community as well. And Ms. Bryant, this is not necessarily a question. While I'm not opposed to Representative Underwood's bill, it seems like we have a tremendous amount of data, both with veterans and non-veterans. As a physician and former director of public health, this is not an area that's unfamiliar to me. It also seems like we have recommendations for how to reduce maternal morbidity and mortality. Do we really need another report to Congress, or is it better that we utilize the money to implement practices and evidence-based practices that we feel will be effective?
In order to address the epidemic, as you stated, Chairwoman, that we are facing in this country, we have to have that information from VA as the representative of the largest integrated healthcare system in our country to contribute to the whole within our healthcare system. Having regularly reported data, being able to see the intersectionality and the impact of intersectionality within maternal health care will be a boon for the rest of the entire industry and being able to address a lot of the issues that veterans face and all women face.
Thank you. And then where I'm going to deviate is this. So, Ms. Elliott, I started my career in the military. I did medical surgical nursing, and I did emergency room nursing. And then I got assigned to Walter Reed Army Medical Center as a young lieutenant, and I was assigned to neurosurgery at Ward 10 at Walter Reed. We did traumatic brain injuries, which were not caused that at the time. I flipped many of a striker frame. Both my husband and I did care after our time, so this is taking me back to my very early days as a nurse, although I did not do neurosurgery as a physician. It is appalling to me that you were told to just get used to it. The VA is probably one of the premier institutions for prosthetic devices, and why we do not consider an exoskeleton or other devices to help our veterans become ambulatory, become independent, is hard for me to fathom. I'm going to look at this as a physician, and what are the consequences of being in a wheelchair when you could be somewhat ambulatory or upright? And I apologize for those of you who are not medical, because some of this is rather, I don't consider it gross, but pressure sores, debridement of pressure sores, the cost of hospitalization, the cost of being bedridden, the cost of urinary tract infections, catheterization, the cost of impaction, all of those, and then not to count what it does to the veterans' individual mental health and that of their families when they could be productive and have active, engaged minds. And I still visit and take care of people who have spinal cord injuries in the civilian world as well. Thank you for mentioning the Community Care Network and how crucially necessary it is. And to me, given the VA's track record on prosthetic devices and helping our military and veterans be whole, it is unfortunate that we would have to consider legislation for the VA to bring veterans back to a livelihood, a production, care for their families, interactions in their communities. So I know I'm pontificating, but I cannot thank you enough for being here today and for your testimony.
Thank you, Madam Chairwoman.
With that, that concludes our second panel. Ranking Member Brownlee, would you like to make any closing remarks?
I don't, but I just want to thank the panelists who are here today, and I think we've got a lot of good bills here that I hope we can move along and move over to the Senate.
On behalf of the committee, I'd extend my thanks to all of the witnesses today. I look forward to working with the stakeholders, my colleagues, the Department of Veterans Affairs, to address the issues we discussed today. The complete written statements of today's witnesses will be entered into the hearing record. I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks and to include extraneous material. Hearing no objections, so ordered. I thank the members and the witnesses for their attendance and participation today. This hearing is now adjourned.